I would like to kick off with one more general question, like for maybe for all of us to answer, but maybe start with you, Anders. So what is your vision of the future healthcare system when looking at these new technologies? How would you envision coming to a hospital in 5-10 years and all these technologies available? How will they help the patients in the future and the doctors and the nurses? I mean, how do you see that?
Thanks for this question. I note we actually spoke about all the three classical components of infection prevention and control in this session. So we talked about technical hospital hygiene. I mean, surfaces, for instance, and cleanliness and sterilization, and the classical technical. And then we talked about surveillance, which is and now we are developing automated surveillance. And we did talk about human behavior, which is sort of my maybe favorite topic with regard to IPC. And my vision would be then, Stefan, that we would have automated systems to collect information, that we don't need to spend manual time in collecting all this data manually. And we've done that for, since Florence Nightingale's days at the Crimean Wars. She started that, and we need to automatize that. So that's part of it. Another part I foresee is that we have systems integrated with the EHR that aids the healthcare personnel to take their decisions. I think we shouldn't have systems that decide for the healthcare personnel, but we should have systems that integrate the information, provide the information, and preferentially visual, I think, because the humans are made to grasp information visually very, very fast. And in my imagination, we have such systems exemplified by a color system that very quickly collect important information on risk for this particular patient at that particular moment when I make my decision on the fly passing a patient. And then I have a sort of a nudging thing that helps me to take the right decision. That's and it should be in the background. And humans should be first still. The technology will help humans in the background, but they will help us to take the correct decisions. That's my vision.
Thanks a lot. How about you, Pontus? What's your vision?
I think, there's clearly a lot of underused information out there. We're collecting huge amount of data at patients, and it's not used in a very intelligent way today. Us as humans, we cannot grasp and make decisions on such complex data. So we need some kind of help to do that. But I completely agree with what Anders says. I think it's not about machines making the decisions for us, but it's aiding us to make the decisions. It's a little bit similar. There are quite a few failures of the self-driving cars, but you will have a lot of aid in today's cars that indicates, okay, you are now going too much to the right or too much to the left, but it's still your decision to drive to the right or to the left. So I envision that, and I think, there will be more and more decision tools that comes out that aids us to make this decision. And I think what we're developing is part of that, and it can be used for that. I think what will be enormously important, which was what Anders was talking about, is how do we then get that into work processes? And we're just starting that. I think a lot of healthcare personnel, they're not used to using this aid yet, and we don't know how to integrate it into workflows in a good manner. So that is something that will be of importance. And then I think if we can get good systems going that are automating output that is valid, we have the tools to continuously improve implementation of new technological advancement, for example. Because if we're introducing catheters or other medical devices, and we want to know, does it make a difference? I mean, I think it was very nice. You showed some very nicely done studies. I mean, we have randomized studies that then they are randomized because then you get the distribution in the two arms of, they are similar, the patients, and that's very nice. But I also think, I mean, we need continuous monitoring. Is there an effect on how what happens in the hospitals? And I think, I mean, we're just beginning this journey, and I think reusing electronic health record data can aid to do that. But I go back to what Anders is saying. I mean, we need all these different components that was touched upon today, I think, to succeed.
Yeah, thanks a lot. And I'm just very. I like your Anders, your reference to human behavior, because I think it's very important. I mean, we have these very sophisticated algorithms and everything to translate that into action. So collecting data is one thing, to make sure that we monitor and surveillance and all these kind of things. But translating it to action, I think it's probably will be the challenge, because the human being is not evolving the same way as the algorithms. I mean, and I think that, what do you think, Anders? What is your thought about the nudging technology in this case to help us make the right decisions, so to speak?
Yeah, I'm kind of attracted with that strategy. And, you know, I think it comes from the economy field in the beginning, but it's sort of the essential is that it should be easier to take the right decision, but still it's your decision and you can decide whatever you want, and there is no one deciding for you. And nudging rather help you to take the best decision for the patient, but it's still adjustable, and I like that. So nudging to me is something that we should strive for. So sort of not a blunt tool that tells the humans what to do, rather a tool that collects information in a better way than we can do ourselves, and analyze the information, and then make that analysis available for the human to take the decision. But I think, as Pontus was talking about, there must be a lot of research done before we know how to construct these nudging things. Yeah. Meanwhile, I think we have to sort of enthusiast people the traditional way. We need to educate people, we need to talk with each other, we need to let them decide on their own environment, to engage people. That's imperative to get things change, I think. And then we should, along with this, we should use these new technologies. For instance, the ones you mentioned by antimicrobial surfaces and other ways of preventing infection transmission. That should be used alongside with these other parts of infection prevention and control.
What do you think, Pontus, in 10 years from now? How much is it possible to reduce healthcare-associated infection? I mean, could it be like you talk about the vision zero of road traffic accidents? Is it even possible to come to zero, or?
No, I don't think so. I mean, it is, as with road accidents, it's not possible to come to zero, because there is a danger in driving a car or walking or so forth. But I mean, there is a lot of data trying to estimate what is possible to reduce. And I mean, that varies from somewhere around 30 to 60% and so forth. And at the same time, the complexity of our patients today is increasing, and making them more vulnerable to infections. I mean, And there's been a huge shift just in the last 20 years of the complexity of patients. I mean, many patients that maybe have their third or the fourth cancer diagnosis that they're treated with. So I mean, and that makes them we use more and more aggressive therapies to suppress immune systems. At the same time, I mean, you were mentioning antimicrobial peptides, for example. That is something that I think can be very, very interesting. That in combination with all these other tools, I don't know, maybe 20–30% is a more kind of realistic figure. That's what I would expect.
Yeah, maybe we should look more on the absolute numbers because, as you say, if the patient population in the hospital is getting more severely ill, then maybe the percentage will be the same or even increasing. But the whole hospital is full of very, very ill patients, so it's okay. We could keep on talking for the entire afternoon and evening because this is so interesting. But I would like to end the discussion now, and thank you so much for your participation. Thank you, Pontus. Thank you, Anders. It has been a pleasure to discuss with you and to hear your thoughts on the future. And I think it felt good to get a little bit glimpse of the future, but also know that the future is here. So, thank you very much.